my borough, my street, my block, and my family, all of which affected. 718, the code of the County of Kings.
1 in 6 cases in the United States are in New York City.
Brooklyn is the epicenter of the epicenter.
There's a problem here. There's an epidemic in Brooklyn.
I didn't want to know for a long time because I was like, you know what I don't know won't hurt me. Well, it did. In 1 week, I had over 1,000 emails from black people, gay people, straight people, white people, Spanish people, telling me these stories about how they found out they were positive.
The best place to have HIV and AIDS is no place. But if you are HIV positive, the best place to be is New York City.
We thought that we couldn't just have a conference. We needed to do some other things in some non-traditional ways. 115,000 New Yorkers have passed away through the HIV/AIDS epidemic since its inception.
We'd like to think that there's a simple solution to the HIV/AIDS epidemic, not just in Brooklyn, but anywhere. There is no simple solution.
The communications work group is concentrating on spreading the message about getting people tested. HIV/AIDS is 100% preventable. Get tested, know your status. You're going to be contacted by Watchful Eye. We're going to talk to you about how we best get the Red Ribbon campaign over to your area.
What we do is we start with a small number of people, 4 or 5 people, for example, and we test them, and we give them 3 coupons and say, give these to people that do what you do. For each one that comes in, we pay them a small stipend to do a simulation of HIV progression in Brownsville, where we're going to recruit 1,200 people and test them and interview them about their risk behaviors and feed that into the computer to sort of predict the future.
What we did is we prioritized a few key things that we thought were really important in terms of how different agencies go about doing their programming, developing their programming, and communicating about their programming. Where are the gaps in services? Are all the different target populations being represented in these needs assessments? Are these needs assessments covering all the different neighborhoods and zip codes within Brooklyn, or are there neighborhoods or zip codes that are being left out?
Once we've identified people who are positive, how did you get them into care, help to maintain them in care? Since many of the agencies were so diverse, we weren't only testing in the daytime, we were testing in the evening, we were testing on the weekends, testing on-site, testing in mobile units. So there were many different kinds of problems that were coming up with linkage to care.
If you're not connected to care in New York City for HIV and AIDS, there is some problem other than access. If you don't think healthcare is important, or if you distrust the system, or if you're afraid of the medications, or you think you don't need to be treated because you don't have any symptoms, those are the things that keep people from being treated.
The New York Community Trust in 2008 made about $170 million in grants, of which $57.5 million went to Manhattan organizations compared to $3.5 million to Brooklyn organizations. Local communities can have the greatest impact on health. They have their fingers on the pulse of their communities and can more effectively focus on the root causes of poor health in a culturally appropriate manner by making at least $1.3 billion available to communities of color. We have to be ready to bring some of that money home.
Funding and services are actually determined by policy. Truth is, when you have clients who are coming in and you cannot provide them services because, for instance, maybe your clients are not being adherent to the medication because they don't have any housing, and you keep saying, well, housing is a problem, guess what? That means you're actually interested in policy.
Let's find a way to work and work better.
And as long as God gives me the strength, I will go out into the community. And I'm definitely going to be a part of this coalition.
we're going to have to make certain that we go and we make an appeal, to our elected officials and people in government to say that resources are needed. I am pledged to work with you in every way that I can to get the resources into the neighborhood, to be able to do the things that need to be done. We're going to have to start working with people in our community. We're going to have to start working with people in our neighborhood. We're going to have to go to our block association. We're going to have to go to our churches and begin to let them know that we need to work together to be able to solve this problem.
Because this disease won't die overnight, but with community intervention, we'll win this fight. Even if infected, we all should be respected. Stop being judgmental and learn to be empathetic. My people are living with the problem and striving for the answer. With unified strength, should bring individuals together. Regardless of a diagnosis, I'm my brother's keeper and my sister's protector. So until this epidemic is over, I'm here forever. Kings County.